Basically. So how much would come from increased taxes and how much would come from increased borrowing?
I think the thing is with Medicare for All is that, as we talked about just now, we're going to end up using fewer national resources to deliver health care for everyone. So if you think about it, Medicare for All actually works like a tax cut for 95% of the American people. Why? Because you're going to end up spending, on average, about $3,000 a year less than you're spending today. That's $3,000 that stays in your pocket. It has the same sort of economic effect as if someone cut your taxes and left you with $3,000 more a year. So Medicare for All really does work like a tax cut.
So if that's right, those savings for the entire country have to come from someplace. Somebody has to get less money. Doctors or insurance companies, somebody has to get less money. So who's getting less money? Where does that savings come from?
Well, most of it's coming out of the middleman, right? That's where so much of the overspending takes place today. It's because we have this additional layer. Someone is standing between you and the person on the other end of your health care, right? And that middleman is taking enormous chunks of money, tens and tens of billions of dollars annually that you're paying in the form of premiums, co-pays, deductibles that are being peeled off by the intermediaries, by the health insurance companies, by the pharmaceutical companies. So when you bring down healthcare costs and you start paying less, not just for the care itself, but also for the prescription medications, that all accounts for much of the savings.
So I said earlier, Bloomberg News has called you, I think, the public face of modern monetary theory. As you describe the healthcare, the Medicare for All, it has nothing to do with modern monetary theory.
No, it doesn't.
We won't be borrowing more money.
Well, it doesn't have anything to do with modern monetary theory because we're just talking about a policy proposal that asks how do we transition away from making the payments the way we make them today to a more efficient system where we make smaller payments in the future.
But as I understand modern monetary theory, and I don't understand it the way you do, it basically says a country that has the reserve currency for the world doesn't have to worry as much about borrowing more funds. Is that fair?
It's pretty close. It's not bad. It doesn't mean you don't have to be the reserve currency issuer in order to be liberated from some of the kinds of constraints that households and private businesses face. It gives you an extra degree of freedom to be the United States of America and to have the reserve currency, but other countries have the capacity to run their budgets in the interest of their people rather than running their budgets the way a household or a private business is required to run them.
But if in fact you can borrow money rather than raising it from things like tax and that, doesn't that affect investment in the country as a practical matter?
Well, if you want to break it down and do a little bit of MMT here. So when the government borrows, remember that it's not crowding out some other form of spending. When the government engages in borrowing because it's run a deficit, let's say, the government, let's just use some easy numbers, spends $100 into the economy, taxes $90 back out. It leaves $10 somewhere in the economy. And we say the government has run a deficit. We write a -10 on their ledger. But we forget that the government's deficit has placed $10 somewhere in the economy. Now the government comes along and says, I'd like to take that $10 out. I'll swap it for a U.S. Treasury. And we label that borrowing. And it's a really unfortunate term that we use because the money to buy the bonds comes from the prior deficit spending. So there's a lot that we get wrong in these conversations about borrowing because we liken it to what households do when they borrow money. Households borrow money they don't have. The federal government borrows back money that it deposits through its budget deficit.
But isn't it competing with private enterprise, corporations, in the capital markets to borrow money? I mean,
no, it's providing the funding first and then swapping the dollars out for U.S. Treasuries, which at least right now still pay a little bit of positive yield. That's not the case, as you well know, for much of the world right now.
Fascinating. So as you advise Senator Sanders on his campaign, what are the major elements of a Sanders economy as President Sanders? We've talked about health care, Medicare for all. What are the other major components that he says this will change the lives of everyday Americans?
Well, you know, this is a man who has spent his entire career fighting on behalf of working people. And so his deep concern, his heart is with the working men and women of this country. And so he talks about things like good jobs, good paying jobs, raising the minimum wage. He's been talking about inequality for decades before it was cool to talk about the problems associated with increasing concentrations of wealth and income. And so he talks talks about ways to address this gulf between the people at the very top and everyone else in our society. Rebuilding unions, again, part of strengthening worker bargaining power. He talks about the problem of college affordability. How is it that we have a generation of people today who are finding it harder and harder to pay for college education, leaving with record mounting student loan debt, 1.6 trillion in outstanding student loan debt. He's talking about canceling all 1.6 trillion. And of course, I could go on and on, but those are some of the bigger things.